Hi, I'm Vinod Mohan. I'm the infectious disease consultant for Heywood Healthcare, and I would like to talk about the coronavirus disease, the COVID-19. First thing I would like to request everyone is to take a deep breath and calm down. We have gone through similar situations before. We had H1N1, we had Ebola outbreak, and we have tackled it very well. We should all know that 90% of the people who gets infected have very mild disease and they are fine. This infection creates some amount of anxiety because it's a new virus, and that's okay. As we learn more about the infection, we are at a better position to kind of tackle it. So what we can do in terms of preventing the infection from transmission, the best method is to wash your hands. If we cannot wash your hands with soap and water, you can use alcohol wipes, alcohol hand sanitizers. Please do not touch your face, nose, eyes, and mouth with unclean hands. Just use the regular respiratory hygiene to prevent the transmission. The most important symptoms are fever, cough, and shortness of breath. And very important that most of these symptoms fit with flu, and most likely if you have these symptoms, you probably have the flu and the regular virus infection that we all have in the community, and not the COVID. If you have these symptoms and if you're worried about this infection, the coronavirus infection, do not panic. Use your phone and call your provider. Talk about it. The healthcare providers are here to help you. They will work with CDC and the DPH and figure out the best course of how we can help it, how we can deal with this. Again, if you have these symptoms, most likely you do not have coronavirus infection. It is the usual flu or the usual viral infections. The best way to approach this situation is to know more about the disease from the right sources: CDC, DPH, your local hospital websites, and not through random WhatsApp messages. Knowing the disease better and knowing how to prevent the transmission, again, hand hygiene, goes a long way. Can you wear a mask to prevent infection? I do not think so. Wearing a mask out in the community to prevent getting the infection has not been proven to be successful. If you have symptoms of fever, cough, like the flu, you can wear a mask to prevent others getting the flu or similar virus infections, but will not help you prevent getting the infection. Again, most patients have very mild disease, and they get over it. At Heywood Healthcare, we have a coronavirus task force. We meet regularly and have policies arranged for the health of the community. Please look at Heywood Healthcare website, CDC, as well as DPH to get the right information. Let us all work together and keep the community safe. Thank you.